plastic surgery guffaws, so to speak. Anybody know what a guffaw is? Not GoFundMe, guffaw. So what does it mean when you go see to get some work done? Well, it means that you've got to get to a point. Somebody said, go to us. Hurricane Ashley, who's that? Well, it means that, you're going to somebody and trust them with your face, your nose, and somebody keeps saying the word hoe on Instagram. What does hoe mean?
I
Saying,
think he might be trying to say hello.
oh, hello. Okay, got you. It's HELLO, not HO. So anyway, oh man, this gets fun sometimes. So, plastic surgery nightmares. I thought it would be kind of cool to go to the internet and go over some things that I found. Some of them are redundant, but it's still kind of cool to talk about. The first 20 patients, thank you very much. This is somebody on Twitter says, I'm so excited to see you. I think that says @lovely something. Well, thank you very much. Some guy keeps saying ho. I think this guy is real confused. So ho. So
The soccer ball?
yeah, he's like ho. Or is it ho ho ho? Like,
Maybe
or
he means hello.
this lady said, I'm so afraid of surgery. Don't be afraid of surgery at Lovely, I think Lovely Das. I can't read that. Sorry, man. Yeah, no, on on Twitter. So let's talk about some plastic surgery nightmares. Let's start with the face. All right, then we're gonna go. Well, what are you laughing at?
He's mad we're not getting his stuff.
He gave you us a sassy face, bro. You can't just keep saying ho ho ho. So anyway, back to what we're doing. Oh my God. Okay, Sino, you're gonna be blocked. Nicole, or sorry, Nereda Perez. Love seeing your videos. You do amazing work. I need to make an appointment soon. I'm so scared. Do not be scared. People come through all the time, and they have no problems. So let's talk about some plastic surgery nightmares. So when you're talking about your face, eyes, lower lids, facial area, and neck, all kinds of things can go wrong. But let's focus on fillers, because fillers, everybody can get to. Sino says, Arabic me. Okay, look, dude, we got you, man. I said hello. I waved at you. Oh, my God. Yeah, okay. Gave you okay, so Lovely SA said, I want to do my breast. You got it, Lovely SA. We're going to do your breast. You know how to get a hold of us. And I want to put a plug for my casting agent, Dina. Dina is looking for mothers and daughters who want plastic surgery together. It's going to be a TV show in 4 to 6 months. They're casting right now. Right now for it. And we're going to put up the mother-daughter casting 51 at Gmail. You have to, it's a mother and a daughter. It can't just be you. You can't cry to me that you don't have a daughter. She's only 10. You have to have like a mother then. And it can't just be you, and there's no sob story. I'm not making the casting call. So we're going to put up this mother-daughter casting 51 at Gmail. We're also going to put up our specials for tonight, which are going to be $99 Xeomin, which is just like Botox. But you have to text in 210-270-8595 tonight. 210-270-8595 tonight so that you guys can get involved. We're also doing $500 off any surgery if you text us your name, phone number, and email. Lovely SA, te quieres opera. Do I like opera? Yes, I do. Thank you. Back to what we're talking about. Steph, it's real lively today. Okay, so let's show you this lady. This is affectionately known as the Catwoman. Look what happened here. So how do you go from here to here? It's because someone didn't tell her to stop. She said to you, you like to operate, I think. Ha ha. Okay, thank you very much. So we went from this to this. It's not my patient. but we found these on the internet. So we're going to talk about plastic surgery nightmares today. So what has happened here? So this lady went from this beautiful person, probably started out to something where they added some silicone. And when you do silicone or these droplets, which you can get in other countries very easily, but you can't get in the United States very easily, you're going to start to form what they call granulomas, or you're going to start to form closed infections underneath the skin. And as they get bigger and bigger, they start involving the superficial skin and starts to tether, or it starts to pull toward itself and create pits.
But wasn't like 5-10 years ago, like silicone, like that was a big deal?
So silicone droplets in other countries are very popular. Today or 2 days ago, I saw a girl, poor girl, they could put silicone in her lower lip and she has all these bumps, and I'm gonna have to take out some of those bumps. So it's terribly sad to get to this state of affairs. Somebody lovely essay, I think that's her, right? Can't read this far. Where are you guys located? San Antonio, Texas. Back to what we're talking about. So getting to this is a problem. This is going to require heat, energy, cutting out some of the other parts of these issues. It's just going to be a mess. So don't get into this place in the first place. Just go to a board certified plastic surgeon or a super trained injector who's not going to put gross stuff in your face to begin with. Now look at this. This is absolutely nuts. I mean, I found this on the internet. This poor girl did something amazingly bad. So probably what has happened here is she got an injection here and then got a massive infection, which left untreated. So if you go to see a non-plastic surgeon who does not have backup, or there is a problem with, there's a medical director on site or within at least a call, you may end up with something like this. And I know a lot of people who inject, but you have to have somebody around that can write for prescription antibiotics, that can admit you if necessary, and that can take care of complications, because this poor girl is in deep doo-doo.
Do you think she's overfilled or should have had?
I think she's overfilled, and then poor technique either caused a hematoma, which is a bleeding, and then eventually this bleeding got infected. So what do you do with that? Well, basically you gotta, hopefully this is hyaluronic acid, which is either Juvederm, Voluma, something like that. Somebody put here, you want a something, what's that on Instagram? Triviola said you wanna, I can't see that. Yeah, it's on Instagram. Oh, was somebody above her? Triviola's joined. Oh, joined. You need a something. Anyway. So when you have this is a huge problem. This either, if this is really bad, this can end up in hospitalization. So you need to have something where a doctor's around to at least, check this out and send you to the hospital, or send it to somebody that can fix this like a plastic surgeon. Oh, somebody named Mike. God, I can't read this. At Mike, Twitter, yeah. Can you look up, would you recommend a dermatologist for liquid rhino? A plastic surgeon is also very good at liquid rhinoplasties, because I do regular rhinoplasties and you have to know where the vessels are. So liquid rhinoplasty in the dorsum is technically the safest, although there are vessels toward the side, and you should almost never get liquid or any type of substance in the tip because of its chance of necrosis. So, you on Twitter?
Yeah.
Can you help me, because I can't read?
Nothing's gonna pop up for me.
Oh, it's popping up here, but
What's necrosis?
necrosis means that you lose the tip of your nose. Like MJ. Is this thing not working now? Oh no. Okay, let's take a look at another one. Look at this. This is absolutely ridiculous.
Wow.
So this lady here has a huge problem. Houston, we have a problem. She started out fairly reasonable. She probably had a little fillers at this point. And then she got greedy, or somebody put in just other stuff in her face. And the problem with putting stuff in your face that you don't know what it is, if you don't see the actual box that it comes out of, then what's funny?
Twitter said Bret Hart is a plastic surgeon. Bret Hart is a wrestler. He looks like you.
Oh, okay. So if you put all this stuff in your face right here, then you get some of these, again, granulomas. These are very hard to fix. Most of the time, you have to cut these out. So you're going to be sent to a plastic surgeon eventually to have this looked at. So, you know, my thought is somebody that has to be super experienced, is not going to use non-FDA products, who has a plastic surgeon as a backup. A lot of people will get these medical directors, and they're not even on site. They're somewhere, they're gone, they're not within the city limits. It's crazy.
I have a question.
Go ahead.
What do you do if you're in the early stages of a mess up?
So something like this, unfortunately, this was not early.
Like early.
So let's say you start early staging, you go immediately back to your injector, you find out who can see her as a doctor, who is trained, and the doctor also has to be trained in injections. They can't just be a side doctor in injections. According to 193.17, which is the Texas Medical Board code, the medical director has to have some training in this stuff. So it can't be normal. So ask who the medical director is if you don't see them or hear about them on site, or you don't know the origins of the training. Anyway, so we have also Spa Black's October specials. I'm going to read them real quick, take a little bit of a break. 3 image chemical pills for $199, and they're going to be coming up. So here we go. This lady here, it's not going to be good for her. To get her back to here will never happen again. She may get some fat grafting combined with some excision, or we'll have to go inside her mouth to remove some of this. This is absolutely a terrible thing that's going to happen to her. Here. Let's go here. Everybody knows this picture. This is poor Tara Reid. Does anybody remember Tara Reid? She was in some crazy, awesome B-rated pictures in the past. Sharknado, I think, and a bunch of others. I think American Pie.
Yeah, American Pie.
So this was her before, pretty. Breasts were in good line. She had a great abdomen. And then what happened is she got over-resected here, but then also she lost a lot of weight. I mean, she became anorexic. So getting to this point, plus an over-resection of liposuction, is kind of the kiss of death for stuff. And somebody said, Mike something says she doesn't look too bad. Great job, man. Just remember that when you get from here to here, you're going to have severe issues. I mean, like severe issues. And seeing her like that, see this right there? That abdomen is absolutely abnormal, no matter what Mike or whoever that guy was on YouTube. This is not a normal abdomen. This is pockmarked. I just saw another 2 or 3 in my office that was over-resected. And right here, this is going to end up needing scar release, fat grafting, maybe some high definition lasering, plus external lasering. So, I mean, this is all very hard to do. You actually need fat, and you almost have to put all the fat back in the bumps. And yeah, I know they look horrible. This is a famous actress. Yeah. So now you're going to have to add like little bits of fat back in. You're going to have to do some resurfacing of the abdomen. You're going to have to do some scar release from underneath with some type of a heat and energy. And even then, it's not going to be completely unavoidable.
Really thin. Like how much you think she weighed?
Now, unfortunately, I think she's probably under 100 pounds, under 90, maybe in the 80s. And I think Tara Reid was, what, 5'3". She was kind of a tiny girl. We'll tell you how much she weighs very soon. So I'll say, don't forget we are going to have a contest for casting. That casting for mother-daughter casting 51 at Gmail. We're going to be possibly hosting a reality show, but we need a few more contestants, which are the mother and the daughter. So if you have a stepmom, you could probably send that too if that's on Twitter, right? Why don't you send Twitter mother-daughter casting at 51 at Gmail?
55107.
That's not 107 pounds, I don't think. Do you recommend losing as much weight as possible for tummy tuck and lipo? Good question, Zoe Fox 914. I like to see you between 20 and 30 pounds of your goal weight. As much as you can, though, would be absolutely super helpful. That's a great question. Some people ask me that, like, how far do they have to be? We just put out the casting call to Twitter. We're going to put out the casting call to Instagram. We'll put out the casting call to Facebook and then also YouTube. Stepmom, daughter, mom, daughter, we need it.
Mom and dad.
The question is, my mom and dad passed, neither remarried between death. Don't know what that means, but maybe you could send that to motherdaughtercasting51 at gmail.com. No stepmom. Okay. Got you. You got what you need. Let's see. Bettina Marquez says, are y'all near the Stone Oak area? One of my offices near the Stone Oak. It's Spa Black North. So we can definitely hook you up there. If you text in your name and cell number and email to 210-270-8595, we'll get you on for our 20 unit or our $99 for 20 units of Xeomin, which is our Botox equivalent. We use 3 different types of Botox equivalents, including Botox, Jeuveau, Xeomin. They're all great. I use all of them on my forehead. They're awesome. We're going to put up all the specials also on Instagram, which is the $99 Xeomin, 20 units. If you want it, you need to put in your name, your phone number, and your email. So back to Tara. What are we going to do here? Here, I would probably, at this point, probably release this with some type of a heat, either a Smart Lipo or an AccuTite or a Face Tight, Body Tight. Then probably stick some fat under here, and it may need 2 or 3 treatments. Then later on, or at the same time, you can absolutely resurface it with some laser. So unfortunately, that's what happened there. So I get a lot of people with silicone in their butt. And as you can see here, when you have silicone in your butt, it turns purple. Why? Because the butt is trying to create a granuloma, and you get these weird purple patches around the butt. Sometimes I have to send you for an MRI to in and around your buttocks area. Can cause extensive damage. And when it causes extensive damage, one of the things that we have to do is make an incision and then go in and cut out all this damage and then fat graft in those areas. And that can be done. Now, if you don't have any fat, you are going to be in a little bit of a quandary, because without fat, you don't get the stem cells that are in fat that can heal the skin and surrounding tissue. So again, if you want to see this. Bonita Sanchez, do you guys take a down payment to hold a date and then keep doing payments? Yes, that's our layaway plan. Stephanie is actually texting for on Facebook, and she handles the layaway. So text us right now. There we go. We just answered your question, so that's a good question. So again, some silicone particles in the butt causing this purple. Eventually, the whole buttocks becomes purple. The whole thing, okay? It completely envelops the area. Then you have to come in, cut all of that out. Hurricane Ashley made a funny spooky specials, so please do that because she's real proud of herself. What's my Instagram? Lovely SA, Dr. Jeneby, DRJENEBY. This does look painful. This is a problem because of the tissue loss the tissue is being eaten slowly by your own body, trying to get rid of the granulation tissue itself. So that's what all this stuff is. So it's pretty bad. Melissa Reyna says, hello, how you doing, Melissa? So how do you fix this? You're gonna have to come in here probably in the midline or lateral. You have to cut out this purple tissue. Then you're gonna have to take fat and then place it within the tissue.
Maximus Prime. Just showing.
So what's happening here with this buttocks? Anybody wanna guess? So she has chronic retractions.
What are all those?
It says, I will be getting a tummy tuck within a few months. What do you recommend finding the right person? If you're in San Antonio, I'm the right person in my area to do it. If you text me where you are, I know a lot of the plastic surgeons in your area, and I can recommend for you some names. We do take fly-ins, however, and we can help you out. But if you text me or tell us where you are, what city, I can definitely push you to the right direction if I know some plastic surgeons in that city or in a big city near it. So what happened here? Oh, Chicago. Oh my God, there's tons of plastic surgeons in Chicago. I like a guy named Dr. Jeff Weinswig, W-E-I, oh, wait a minute here, let me answer this. Implant turn on its side. No, this is retractions from either a hematoma or an infection causing the body to pull it together. This could also be an implant that has over the muscle that has caused these adhesions to pull toward the midline, and you get these bumpies. How do you not get this? Well, you do it right the first time, which is an intramuscular technique. And if you do an intramuscular technique, you'll take the implant out, and then you'll put the implant within the muscle. Now, intramuscular technique for butt implants is the best way to put in a butt implant. Over the muscle, you'll get some of these adhesions and retractions. Under the muscle, you're gonna get too close to the nerve. So, again, how do you fix this? You're gonna, LaDancy says, hey, LaDancy. So take the implant out and wash out the area. Sometimes I can if it's really bad, you take the implant out and let everything rest for about 6 months to a year to get the skin to come back. You might have to add fat to this area. And then in a year later, come back to place an implant at a later date. It just depends on how bad this, we have a loss of superior fullness. How come the Kardashians have not had issues yet? Well, we don't know. I mean, you never see anybody on TV having any issues. So that's not completely not known yet, or if it's ever going to be known. So again, you have these tissues that are contracted around the buttocks implant. And when you have these tissues that are contracted, again, you can remove the implant. And the safe thing to do is to be removing the implant, letting everything settle down, placing fat in, and later coming back. That would be the conservative approach to something like this. And either placing a new implant, or the last things I have is superiorly placed implants. So implants can superiorly displace for many reasons. This is called a capsular contracture. And capsules are, they can happen because you're placing a foreign body inside the breast. Sorry, I'm trying to center it for all of you guys. And so one of these implants is pulled upwards. You have this centrifugal force that pulls inward and causes the implant shell to get hardened. We don't know what causes capsules. We're working on it. We think it's biofilm related, which is a small layer of film, which is a small layer of film around the implant. Oh, it paused due to poor connection. Hold on. Sorry about that. We lost it from a connection. So to fix something like this, you actually have to make an incision. And classically, you make an incision, pull the implant out, take out the breast tissue, just so, and wash the area out, put in a new implant. Maybe you put in some type of a tissue like alloderm, stratus, something to reduce the chance it's going to constrict again, and then sew it up. We also Oh, look at Deborah Linscomb says, I'm coming to see you. Be coming from Lake Jackson, Texas. What's a hotel pretty close? You want to stay at, why don't you call our office or text us at 210-270-8595. We'll set it all up for you. We're about 2 miles from this great Drury Inn, Drury, on I-10 in Wurzbach. Text us right now or we will find you. If you text your name, cell, email to 210-270-8595, they will grab your info and get you set up. So you don't have to do any of that. But thank you for coming, Deborah. Where's Lake Jackson, Texas? Ashley? Oh, that's really nice of you to come all the way from Houston. We appreciate that. We also have what they call now an Aspen. An Aspen is a ultrasound device that uses focused, patented ultrasound waves to heat this capsule so that we can push the implant left, right, and superiorly over 10 treatments in a heated capsule that now stretches and allows the implant to drop. So you don't have to actually cut this out anymore if it's a grade 1, 2, or 3. Sometimes on a grade 4, which is really hard, which is a superior or high-based implant with a real painful nerve endings, and it just doesn't feel right, then at this point, it would be wise to get surgery to remove the implant. So this right here would be use non-invasive Aspen capsular contracture. And today, if you text in your name and cell phone and email to 210-270-8595, during tonight's show, then we can give $500 off your surgery. Also, don't forget all of our specials. Jessica Rodriguez, is a tummy tuck safe to do 2 years later, 2 years after getting your hernia surgery and hernia knots? Yes, it is safe in general. I'm around mesh all the time. It's not a big deal. Text us 210-270-8595 to lock in your $500 off surgery, Jessica. Also, Deborah Linscomb, please text 210-270-8595 to get your $500 off. We can get you in there. So again, we're going to go back through it one more time for those of you guys who missed a lot of it. So we have the Catwoman here, poor lady. And this lady's famous. This lady had terrible time. The number one problem with this lady is she didn't find someone who said no. Honestly speaking, when you have a lot of money like this lady, an heiress, she just kept going and going until somebody said yes. In my practice, I say no a lot. And you need to find somebody who's going to say no, is just going to put their brakes on. Somebody asked, how much does a Juvederm rhinoplasty cost? A Juvederm rhinoplasty cost, well, it depends. 1 cc of Juvederm is somewhere in the realm of $700 to $800. And that's with me injecting per cc. So again, here it's going to be terrible. You're going to have to cut out some of this tissue. You may have to add some heat to it. Here,
Zoe Fox shared and put money down for it.
yeah, thank you, Zoe. You're awesome. We love you. Mike Baker, my nurse who takes care of you after surgery, just said, great patient last night, no issues. As always, 5 years without one problem. Glad to be part of the team. Thanks, Mike. We love you. Thank you very much. Mike will be one of your nurses, the main nurse that takes care of you after surgery, because I don't believe in just sending you home. We send you to a hotel with our nurse all night so that you don't have to worry about it. You don't have to be transported to the hotel. The only thing you have to do is show up for surgery, and your loved ones can go right to the hotel, and we'll meet them over there with you. So a little plug. So anyway, from her, we're going to have to do something about removing some of the silicone, even from the lips, even surgical, and then eventually taking some fat and doing some layered fat grafting with possibly some laser resurfacing. This poor girl. This is what happens when lips go bad. We have a ton of people giving us hearts on Twitter. You know what? Twitter is just full of some crazy people. That's all I got to say. So this right here can be completely avoided. I've actually never, ever, well, let me knock on wood, 19 years ever given anyone this type of a problem. This is a problem because they probably went and got somebody who injected. They had a problem. They went back. That person didn't fix it, or they didn't send them to the right place, or there wasn't a plastic surgeon there like me to help you out. So everybody thinks all these injections are innocuous, that anyone can do them, but not everyone can do them. And some people just set up shop, and some of their medical directors are 8 hours away. I mean, you got to ask, how far is the medical director? You got to ask for the person's name and credentials, because you can end up like this. I mean, you can. This happens. So let's see here. Yeah. Same thing with this lady. She was actually fairly decent here. And then she got there. This is a problem because these are infected granulomas, long-term infected granulomas, with tethering of the skin and sort of pulling down on the skin on top of balls of filler and or silicone droplets. When you put silicone droplets, that's what happens. Melissa Reyna says she had cement injected, probably. We don't know. I mean, that was fairly decent right there. But then, with enough money, somebody can make other people do this. So remember, a lot of times you want to go to somebody like me or my staff that'll put a brake job on this, because this is terrible. So then let's go here. Okay, back to this. What we thought about this is very hard to cure. This lady had actually looked very, very pretty. There's her abdomen before. This is the famous Tara Reid, poor girl. Look, her abdomen, smooth. She was thin. Her breasts look good. Now with all the weight loss there, you can see the outlines of the breast implant, and you can see this pock marking of the tissue right there. So that's where we have it there. You see these indentions and pock marking of the tissue everywhere. So that's what we have there. So to fix this, you're gonna have to free up all this area underneath the skin. And once you free up all this area on the skin, then you're probably gonna have to fill this in with liposuction. After you liposuction areas, if she doesn't have any fat, you'll probably have to do some type of a Sculptra or filler in these areas. Each individual one is going to be very expensive to fix, and then you'll have to resurface the top of the skin for the lumpy bumpies. So this is a very terrible, terrible problem that this lady had. You like that, lumpy bumpies? Some of the things you laugh at are kind of interesting, but this lady had severe reactions to probably siliconosis into the butt. And don't put silicone in your butt, and don't give butt injections where you don't know who the person's doing it, their credentials, and what kind of stuff they're putting in. This is probably industrial silicone. It could be micro droplet silicone, but other than that, this is going to be very hard to cure. This is going to be removal of these of this cement area with possibly some laser resurfacing of the skin later, but removal and replacement with fat. Fat has enormous properties with its own stem cells that can help to heal even the skin in this area, but this wouldn't be an easy fix, I can tell you. Let's move down. This lady has retractions from either buttock surgery vis-a-vis implants, or she has just indentions from hematoma or infection. So how do you fix something like this? Well, you have to either remove the butt implant or the capsule, and you're gonna cut it. Then you're gonna cut the bands and let these indentions pull back out. Then you're gonna add some fat to it. Sometimes when it's really bad, I just take out the implant, let it sit for about a year, let all this heal up, maybe fat graft at the same time, and come back in a year and actually do the projection So it's almost a two-stage operation. And that would be the conservative thing to do. And probably the best thing to do would be something like that. So that's what that. This right here, oh my Lord, I forgot to show you guys this one. This is a terrible mess, man. This lady has siliconosis and some type of a purplish injection that's causing her to have severe reactions in her buttocks. You can see that the buttocks is shiny. It doesn't look good. This is terrible, terrible, terrible what's happened to her. Again, I don't even know how to get to something like that. I would have to probably get an MRI to make sure that what's in the buttocks at that time, and then be able to pull out some of the diseased tissue and then replace it. And Michelle yours says, wow, that looks painful. Wow, it looks painful and terrible. So you're right. And again, to fix something like this is very, very difficult, and very dangerous for this person to have this kind of stuff in here, because if it opens up, it can get cellulitis, and cellulitis can quickly get worse and worse, and sometimes it can end up in sepsis, or sort of what they call a blood poisoning. So to fix this, MRI first to judge what's actually in there, what layers it's in. The best thing would be that it wouldn't be too many areas that we have to do that, but with this in place, take out as much as you can by excision, and then replace it with more fat at a later date. You could also put a butt implant intramuscularly. And Hurricane Ashley says, ouch. And I don't know why you're saying ouch.
I'm being interactive.
Oh, you are? Okay. So then you can put a butt implant intramuscularly to give back the projection, maybe even at a later date. So that's what that. Joe John can't even believe we're doing this. Can't believe these pictures. And again, lastly, something with the breast. One of the more common causes of going back is what they call a capsule, or a high riding breast, due to tissue that has constricted around the implant. When you have constricted tissue around the implant, you can actually use an ultrasound device that will heat up that tissue. So pretend you're chewing gum, and then you eat some ice, and what happens to the gum? The gum gets hard. But then if you heat the gum, like the ice goes away and your mouth heats that gum back up, it stretches again. So that's what we're doing. We're heating the gum, and then we're pushing the implant in basically 8 different directions and cardinal directions of the compass, plus the intracardinal directions. And that allows us to stretch that tissue over 10. So again, that's how you fix these. They're not easy. Best if you just go to somebody that you know can treat your complications. People who go abroad for surgery, when you have these complications, no one wants to fix them or touch them, because then it becomes their problem. So better to just have your surgery here in the United States, and that way you can be assured that someone will be around to help you. I'm partial to board certified plastic surgeons, obviously, because we can operate on all parts of the body. If you go to somebody non-board certified, you're going to have to be sent to a board certified plastic surgeon eventually for something like this. So just to let you know, that's my push. Some housekeeping tonight. We're still looking for casting for the possible TV show in 4 to 6 months. And what they're doing now, Dina, the casting director in Toronto, is casting mother-daughter casting51 at gmail.com for all you mothers and daughters who want to have surgery together at the same time. And if you want to have the surgery together at the same time, the TV show will actually put up the money for you to do that. And it is a reality show, so it's not just the procedure like Inside Edition, is actually going to follow you around for a while. So several of my friends are going to be doing it. I hope you've enjoyed this. We are going to be giving away, for $99, you'll get 20 units of Xeomin for $99, but you have to text in your name, your cell phone number, and your email tonight. And anybody who wants surgery, who isn't already on the, who already hasn't paid or is a new patient from tonight, will $500 off. Don't forget to like and go over to my YouTube site, drjenebeplasticsurgery.com, subscribe and hit the notification bell. Joe John will give away a gift every week. We'll pick one on Thursdays or Fridays, and he'll tell you how to get a hold of the gift, and he'll give the coupon to Stephanie to tell her what they want. And we'll pick something every week. Maybe you get a facial. Subscribe, leave your email and a comment, and hit the notification bell, right? So you can get all my surgeries. We just put up mother-daughter casting. Call mother-daughter-casting51@gmail.com. Michelle Yon says, I wish I could, but my oldest is only 16. I know. We've gotten probably at least 30 or 40 of those. One lady called and said, my young mom need it, but I know, but that's not how this works. It's a casting call. They're looking for specific types of cast. Somebody on Twitter says, explain why so many women who undergo multiple facial processes look the same, I think. Well, what's happening now basically is that the Instagram with its filters and the way it's held at 30 to 45 degrees, 1.5 feet away, is starting to make people who are three-dimensional beings look two-dimensional. In order to look good in 2 dimensions, they're adding a lot to their lips and they're exaggerating things. And it's not looking real good as far as I'm concerned. So that's what's happening in a nutshell. It's hard to say 100%, but it is a problem. So I loved having you guys here. Mother-daughter casting 51@gmail. We have our specials for spa on spablack.com. We have our specials. I think it's a $13.999 for breast augmentation plus tummy tuck, and that's breast with silicone, and an overnight stay included for $13,999. You're saving basically $3,000. Awesome. And we have a ton of awesome Spa Black specials. We're getting some more staff as we're expanding, and we just love that you're with us tonight. And thank you for joining us tonight. I know you had a lot of other things you could have done. We try to make these education, but we want you to ask us questions as well. So don't ever be afraid to ask a question. Even if you think it's silly, we still have fun with silly questions. And we love you, enjoy you. We will see you next Tuesday night. Probably we will come up with something very fun for you. I haven't thought of it yet, but we'll come up with something soon for next Tuesday, join me at 7:30 to 8. And if you want a consult tonight, I'm doing virtual consults through my website. You click on my website, drjenebeplasticsurgery.com. You hit the hamburger button, drop down to virtual consults, and then I'll do them tonight on a secure laptop, and no one will know that you're there. And if you're from out of town and you want virtual consults, I'll do the same, and they'll get you set up. So even if you're from out of town and you're watching and you just want to talk to me, they are complimentary virtual consults. You can go under our it says a doxy.me website, or you can go to virtual consults on my website and click the button, and we'll get you into it's a specially designed consult room in here that's HIPAA compliant. And I'll be taking consults tonight for the next 10 minutes. We usually have about 2 or 3 a night. So if you want to be in it, let me know. See you guys later.